Children with special needs often have difficulty communicating and learning language. How would you answer the question, is it possible for a child with special needs to learn more than one language?
I would answer by saying if the child has the capacity to learn one language, then yes, absolutely, the child has the capacity to learn two languages. I think it's a very common misperception that when a child does have a communication disorder that it would be better to reduce them to one language. And actually, there's no scientific investigations that have supported that idea. And I realize that may sound very counterintuitive. If someone is struggling to learn one language, it's easily thought that they would have a lot of difficulty learning two. But in fact, the research that has been conducted, and I do realize it's not an extensive research base, but what has been conducted has shown that children do in fact seem to learn two languages as well as monolinguals learn one. A very notable study conducted by Kay Raining-Berg and colleagues, even children with Down syndrome, they compared children with Down syndrome to other monolinguals with Down syndrome, as well as to age-matched monolinguals and age-matched bilinguals. So comparing them to three other groups, the bilinguals with Down syndrome, the bilingualism didn't seem to impede their English language growth, which is really quite impressive. So again, I've looked thoroughly because it's such a common thought that we hear over and over. We think it must be coming from somewhere.
Well, it's interesting. When I was working as a speech-language pathologist with Down syndrome children, a lot of parents were told not to communicate with their child in their native language. And some of these children are 5 years old. They had learned maybe 20 or 30 words in the 5 years of their life, and now they were being told, we don't want you using those words. You're going to be in school and you're going to be in an English-only program. Let's just focus on getting you a vocabulary in English. And it was troubling to me as a clinician because I had known, those 10, 20, 30, 40, 50 words expressively had an underlying receptive vocabulary that was probably a lot higher. And my professional instincts told me at the time, and from what I had known, that we had to capitalize on those words that they did have in Spanish and also try to augment their English vocabulary too if they were in an English program or in a bilingual program. But it really was difficult for the parents because they felt like their language wasn't valued, or they couldn't communicate with their child in their native language, or that they were actually doing something that would negatively impact the child's education. So I understand that this is an issue that is close to me, and it is good to communicate and talk about what the research really has to say about it.
Exactly. And even children with autism, I've seen in my clinical practice, even children with autism can learn two languages. So again, it does seem very counterintuitive, and so I think a lot of these recommendations made by professionals they're well-intended. Of course they're well-intended. We want the children to make progress, we want them to achieve their highest potential, and some professionals make that recommendation thinking it will indeed help the child. But again, we need to be operating from evidence-based practices, and the evidence doesn't indicate that that's the case. In fact, we need to think about what happens when we take away a language, like what you were saying. You were giving the example of how building on a child's first language is important, and the research actually shows that building on a first language can actually help the second language. There's lots of research, a very, very thorough, rich research base indicating that that's the case, that the stronger a child's skills are in the first language, that actually benefits. So what happens if we take that away? We take away their support system. Well, that can actually have a negative effect, and it doesn't. To me, it seems that it just doesn't go with what we're trained to do. We're trained to build language, enhance language, really maximize our client's communicative potential. So taking away a language conflicts with that. And again, because there's no evidence to back that recommendation up, I strongly encourage parents try not to feed into those recommendations, and I certainly would love to see professionals moving away from that recommendation and again really embracing what the research does and has told us.
What do you recommend to parents that are considering teaching their children 2 languages?
Well, actually, I don't have a recommendation for everyone. It's certainly an individual family decision. And if it's important to the family, then I would recommend by all means to go for it. If they're able to provide lots of rich language experiences for their children in both languages, there are many ways to do it. Children can learn language in the home, obviously. They can learn language through educational programs. They can learn language through community programs. But it does take, just as it takes a rich language environment to raise a monolingual child, it takes a rich language environment to raise a successful bilingual child. So again, lots of rich language usage in the home, lots of vocabulary, rich conversations with your children. Hopefully you could find an SLP who would help you do that and make recommendations. So I think you can be perfectly comfortable with your decision to raise your child with 2 languages. Make that clear to the speech language clinician that it is very important for you and your family, and then hopefully that person could give you additional strategies and recommendations for how to do that.
Well, Dr. Groman, thank you for coming out to talk to us about issues in bilingual speech-language pathology. We really appreciate your time.
My pleasure. You're welcome.